announcement that
Thank you for joining the press conference. In just a moment, we'll bring Dr. Darden for the Tulsa Health Department. We're trying something new, so please bear with us for just a moment. We'd like to introduce Dr. Dart with the Tulsa Health Department now.
Good afternoon. As of today, there have been a total of 314 Tulsa County residents infected with COVID-19. Tragically, 16 have died. Our entire community has been impacted by this virus. To those families in particular, our hearts and prayers are with you. In reviewing the data for Tulsa County COVID-19 deaths, the average age for individuals who have died in our community is 71 years old. Of those 16 individuals, 12 were reported as white, 3 as African American, and 1 is unknown. Our team of epidemiologists continue to conduct investigations for all confirmed positive cases in Tulsa County to determine where the exposure may have occurred, conduct risk assessments, review underlying health conditions, and identify outbreaks and disparities. In the absence of treatments or vaccines, our best mitigation strategies remain social distancing to slow the spread of this virus. Thank you to everyone who continues to follow recommendations to frequently wash their hands, sanitize surfaces, wear a cloth face covering in public, and stay home. If you have symptoms of COVID-19, stay home and call your healthcare provider. Do not go to the emergency room unless you have a true medical emergency. If you have to call 911, tell the operator about your symptoms so that responders can take the appropriate precautions. The Tulsa Health Department has about 400 specimen collection kits available to continue to provide specimen collection for symptomatic individuals who are uninsured and underinsured or who do not have a healthcare provider. Anyone who meets this criteria should call the Tulsa Health Department at 918-582-9355 for a phone screening by a public health professional to determine eligibility. Specimen collection is done by appointment only at an undisclosed location. You'll be given instructions for drive-through services at the time your appointment is made. We've been hearing a lot about modeling. Modeling is an important tool to predict what may happen in our community. We continue to update models as we get better data. Modeling is an iterative process, but all projections are just potential. In our newest version of the model for Tulsa County, we have been able to reduce the potential number of infections and deaths from previous versions. We project that potentially up to 176,000 cumulative infections will occur from February to August. This includes people who have all gotten the virus and have already recovered. We are projecting there could be potentially up to about 2,100 deaths. We have made other adjustments to the model based on new mortality data. This means, mobility data. This means the more we know that Tulsans are staying home, the more we're able to revise our modeled numbers to remain more accurate in our projections. I want to take this time to thank Mayor Bynum, Commissioner Keith, and all of our local municipal leaders who have made the tough but necessary decisions to protect residents of our community. We project a peak of new infections to happen within the next week. This will be a crucial time for staying home and limiting social contact. With Tulsa County communities on the various restrictions on movement, we are happy to hear families are discovering alternative ways to observe the spring holidays, including streaming and online faith services, hosting virtual dinners, and holding family-only egg hunts in the backyard and more. Limiting face-to-face contact with others is the best way to reduce the spread of COVID-19. We understand people have a desire to be with family and friends over the holidays, but right now we are asking families to do this virtually to remain compliant with social distancing measures. Follow guidance from authorities where you live. Consider a grocery or restaurant delivery services for your spring holiday meal. Cover your mouth and nose with a cloth face cover when around others, including when you have to go out in public, and stay at least 6 feet away from others. It's good for our emotional health to stay connected with friends and family that don't live in our home. We ask for just a short time longer to call or use video chat to stay in touch. Tulsa County residents are better off staying at home, and we're helping each other more by using digital resources we have to celebrate this time and to celebrate our families. Spring is a hopeful season. It brings transformation and change from darkness to light. We don't remain in anyone's season or cycle indefinitely, and we won't remain in this one either. I want to remind you all that life is a series of seasons. We too have circles and rhythms to our lives and to our growth process. Please take this opportunity to introduce positive patterns in your life, slowing down, refocusing on what's really important and what's truly a priority, like family and your health and your community. I want to inspire you to feel hopeful about believing that something bright is ahead for all of us, and we will keep moving forward. At this time, I'd like to introduce Mayor Bynum.
Thank you, Dr. Dart. Please stand by while we bring the next speaker up. We would like to introduce Mayor G.T. Bynum with the City of Tulsa.
Thank you, Dr. Dart. I'd like to start by just talking about what I view as the road ahead for us in Tulsa. I know that's on a lot of people's minds right now. In my mind, we have spent the last 4 weeks preparing, and we're right at the end of now 4 weeks since we initiated remote work protocols for the city of Tulsa. And we began asking people to work remotely and to practice social distancing in Tulsa. We have spent these 4 weeks as a community sacrificing a great deal. And all of that has been to prepare for the next couple of weeks in our community. Based on the modeling that Dr. Dart just talked about, we expect the peak contagion rate in Tulsa to hit early next week. And that's important. One, because that's when we can expect that to really peak out. But also it's important to remember that in the lifespan of this virus that we've seen all around the world, people don't immediately contract it and go to the hospital. There's a period of time where the virus builds up within a person's system, and then they become symptomatic. And then after a couple of days, we begin seeing people start needing to seek hospitalization. Because of that, the modeling that the health department is sharing with us shows that while we could have a peak of contagion early next week, based on their data, we should not expect to see that peak load on our hospital system until early May, the beginning of May. And that's what we've been doing all this social distancing for, is to prepare for that event, to allow enough capacity within our healthcare system for everyone who needs the most severe medical treatment to be able to receive it. Now, the good news from my vantage point is that what we've just spent doing for the last 4 weeks as a city and as a metro area, it's working. When you see the data that our health department is utilizing and the way they've updated their modeling for right now versus where we were just a matter of weeks ago, we're talking about thousands of people's lives who are being saved by Tulsans taking social distancing seriously. And so I cannot thank enough everyone in our community who has sacrificed so much to protect the most vulnerable people in our community and to make sure that our neighbors have the medical assistance that they need to get through this, and for us as a community to be able to return to our normal lives as quickly as we can. With that said, as we head into the peak contagion moment, which coincides with a holiday weekend, it is incumbent that all of us continue to do what we've been doing. We cannot let up now. We have to stay firm and vigilant in practicing social distancing as a community. And if we do that, we will keep this contagion rate lower. We will keep our death rate lower, and all of us will be responsible for saving thousands of lives in our city. And so I would ask everyone as you go into this weekend, and I know, believe me, how much we all want to be with our extended families and our friends on a holiday weekend. What I would ask, though, is that we not think as much about all the things that we can't do over the next couple of weeks, but instead think about what we're a part of right now, every single one of us. We're part of one of the greatest humanitarian initiatives in the history of humankind right now. There are people all around the world who are sacrificing in the same way that we're sacrificing here to save their neighbors, just like we're trying to do here. If we ever needed a reminder of our common humanity, this is it. And so please think about that and how we are united with people all around the world. People we'll never meet, but we are united as human beings in this effort to save our fellow people, our fellow citizens, to save mankind. I also want to bring up just a couple updates. We have had over 800 individuals contact tulsaresponds.org to seek no interest, zero interest loans for their businesses or their nonprofits. We have this in place to tide people over until the federal funding, which is far more substantial than anything we could afford locally, hits the streets here in Tulsa. If you're a business owner, and I just had a business owner reach out to me this morning and they hadn't heard about it. If you're a business owner and you need that kind of assistance to tide you over to get one of those small business administration loans, please go to tulsaresponds.org. And not only do we have zero interest loans that are being funded by the city of Tulsa through that, but we also have navigators, individuals who can help you through this process of identifying other funds that are out there, whether that's through the state or federal agencies or other businesses that are out there. So I strongly encourage any business who hasn't already reached out to tulsaresponds.org that needs that kind of assistance to please do so. It's about so much more than the zero interest loans. There's comprehensive assistance there for you to navigate which can be a very complicated field out there. We're very grateful at the city of Tulsa that we received this week an allocation of protective equipment for our first responders from the national stockpile. It was allocated to us by the state government, and that will give our police officers, our firefighters, our emergency medical responders the protective equipment they need, and so they don't have to hesitate at all. And they haven't been anyway, but at least now we know that they'll be protected when they're going to respond to an emergency. They don't need to have that concern about whether or not the person that they're helping has coronavirus. So we're very grateful for that allocation of protective equipment. We need more in the long run, and our team at the City of Tulsa is working with Tulsa Area Emergency Management Agency on that. But it's good news in the near term for us that we have that protective equipment for our first responders. Another group that I don't think we do a good enough job thanking in this environment is our trash haulers. We found that as of yesterday, our recycling tonnage at residences during this event is up 18%. Our refuse tonnage is up 16%. And so our trash haulers, our recycling haulers, they're processing so much more every week than is normal under normal circumstances because we have so many more people home. And so I want to thank them. And I also want to encourage all my fellow Tulsans, if you're sick, please double bag your trash and put it in the gray bin so that we can protect the health of our haulers. One last thing I want to remind people of, and this is important at a time like this, when we're talking about receiving small business administration assistance from the federal government, when we're trying to get allocations of protective equipment from the federal government's national stockpile. We get all of those things based on our census count here in Tulsa. And right now, everyone in our community should have received in the mail your census notice to complete. I did it online in the midst of responding to all this, and it took me 10 minutes to do for a family of 4. It's very quick, and completing that is so important to have an accurate population count for us in Tulsa. And so I encourage everyone to please take a few minutes, if you haven't already, to fill that out. And let's have a good count for Tulsa, because there are hundreds of millions of dollars at stake in how good of a count we have on the census. Lastly, I just want to wish everybody in our community a safe holiday weekend. And I want to thank you for what you're doing. It is very important when we see the data, whether that's on the online mobility data that's available out there that shows how we're doing compared with other cities, or when you hear the updates from the health department, to know that Tulsans are making these sacrifices to stay at home and stay safe and minimize our exposure to other people. We are slowing the spread of this virus, and we are saving lives. And I cannot thank you all enough. And now I'd like to turn it over to my colleague from Tulsa County, Karen Keith.
Thank you, Mayor. Stand by while we bring Karen Keith on board. We would like to introduce Karen Keith with Tulsa County.
Right. Mayor, thank you. And Bruce Dart, you two have done a remarkable job. And I just want to thank you and hope that you take some time and enjoy your families this weekend. So some updates. The Board of County Commissioners is going to meet on Monday. We need to do an extension. It's on our agenda to keep restrictions in place so that we can keep the number of people coming and going from the courthouse to a minimum. I'm happy to report that Sheriff Regalado says the jail continues to have no cases of COVID-19 among the inmates. 2 inmates who had symptoms, fortunately, those tests came back negative. So far, all these measures that the sheriff and his team have implemented to protect the jail are working. And the population is at 974 this morning. That's down from normally it's 1,200 to 1,300 on average from just a few weeks ago. The expedited docket has been a big help in keeping those numbers down. And our court clerk continues to do all the back of house functions to keep the wheels on our justice system. And while the courtrooms are empty, this work has to go on. Some 39 criminal charges on average are being filed every day. And the Tulsa County Election Board and the Oklahoma State Election Board are asking voters to register absentee in an effort to keep the numbers down at polling stations in the future. Visit the election board website for information to help you request an absentee ballot. Now, if you don't have access to an electronic device to fill out your online application, you can obtain a hard copy from the Tulsa County Election Board on Denver, but please call ahead. And then kudos to the Tulsa County Election Board for their efforts to protect candidates filing for office this week. They made it so easy and safe. They did a drive-up filing, so it was really creative. So thank you, guys. And if you're looking for a way to help those in need while staying home, you can donate online, and I've mentioned this before, to the Tulsa Area COVID-19 Response Fund. It's set up through the Tulsa Community Foundation and the Tulsa Area United Way. You can pull up either website and make a donation. Those funds support the local agencies who help everybody who is in need right now, with whether it's temporary unemployment, lost income, or unexpected food and child care expenses. And then I love this one. The Restaurant Employee Fund, set up by the Lobeck Taylor Foundation, has already cut checks for some 235 individuals at $1,000 apiece. ONEOK generously gave $75,000 to the fund. And you can help out in any amount. And this goes directly to the members of our community who need it most. And it's really, really easy. Just go to the Mother Road Market website, pull it up, and figure out what you want to do as a donation, and they'll make it happen. And then the Family Center for Juvenile Justice, they have reduced their population to 12 young people. And this week, with the help of Tulsa Area Emergency Management Agency, they gave us some additional masks and sanitizer. But like everyone else, they are scouring the internet to find these much needed items. And in addition, I love this story. Presiding Juvenile Judge Martha Rupp Carter has been making masks for essential staff that continue to work every day. And then I want to thank a group of quilters at Tulsa County led by Thora Cohey. They are making additional masks for the Juvenile Center. They volunteered and stepped up. So I really want to thank you. And I want to remind you again that if you believe you have the coronavirus, call this number. It's 582-9355. Again, it's 918-582-9355 for a phone screening. And finally, I want to give a shout out to our 2 state schools. OSU Medicine for their quick response, ramping up testing for the state by doing some 1,200 tests a day with a 24 to 48 hour turnaround. And they set up 40 different testing sites throughout Oklahoma. And then OU Medicine is taking part in a therapeutic trial in Oklahoma City. They're encouraging COVID patients who tested positive to donate plasma as soon as possible. And this will allow them to do plasma infusions in the most serious cases. Now, in closing this holiday weekend, it is all about hope. And I love the inspiring words of Bruce and our mayor. You know, it is so refreshing as we walk our neighborhood to meet so many faces we've never seen before. And then we've got these neighbors who their children have been putting up art in their windows. And so others have picked up on that. And so as all of us pass those windows, it just gives us joy. So this is a weekend of hope, but in order to continue staying safe, we just can't stop doing our social distancing. So please continue what the mayor and Bruce Dart have asked, and let's stay home, enjoy the holiday weekend with our family, and make the best of it. And we'll see you soon.
Thank you, Commissioner Keith. Please stand by as we bring our speakers back on. We'll now be taking questions from the media.
Our first question is for Dr. Dart from KJRH. Vice President Mike Pence yesterday said federal support for community-based coronavirus testing sites across the United States will end today. How will that impact Oklahomans?
You know, frankly, I'm not sure that it will. I mean, we continue to get and work very hard to get the supplies that we need to ensure that those who need a test can get a test, and that's not going to stop. So whatever it is that we need to do to get this job done to serve our communities, we're going to do it. And you've seen from the leaders who spoke today that there's nothing going to stop us from moving forward. And ensuring that we've got the materials we need to protect all Tulsa and Tulsa County residents.
Okay, from CMG Tulsa for Dr. Dart, we saw peaks and valleys in the statistics from Italy. Do we anticipate a similar pattern here?
You know, our pattern really hasn't matched the pattern that's been shown in Italy, and I think we've got evidence that Tulsans continue to social distance, and they've been doing the right thing as they've been asked to do. And so I think the only change we're looking for is a flattening of the curve. If everyone continues to step up and embrace their responsibility to stay apart.
Okay, from Fox 23, Dr. Dart, are people still going to get sick after we peak? Does that mean we could see an escalation in cases when the projected peak passes because people think we're in the clear?
You know, and frankly, it's really too early to answer that question. I think that's always a possibility. This virus, we're still learning how it functions and the disease pathology behind this virus. So we are, and that's, I think, one of the reasons why we're trying to project so accurately so that we do get the right information out, knowing, and we've always been very honest about the information changes rapidly. So we'll continue to look at our data and use our modeling analytics to tell us the story that we need to tell the public. And when it changes, the first thing that we'll tell is all of you.
Okay, Dr. Dart, are deaths attributed to COVID-19 confirmed through testing? Why or why not? And does Tulsa County have enough available ICU beds and ventilators to meet the need for the number of cases that could be coming at the peak? What is the number of ICU beds and ventilators that are currently being used and what's available?
So let me say that when anyone that has COVID has passed away, we attribute that death to COVID regardless of underlying health conditions, because it was the COVID that was the final thing that we think put people in that position. You know, we've been looking at the data. Hospitals have been very good about sharing what their resources are, and we feel that at this juncture, if we continue to social distance people that do become ill, we do have the capacity in our hospitals to deal with that and to treat them accordingly. So that's why it's important that we not get, I think, too comfortable and not get compliant that if we stop social distancing too soon, then we do have to have really serious conversations about how our hospital system could be overwhelmed. So it's important to, I think, embrace the message, to stay on task with that message so that the hospitals can do what they do and we can keep all of our citizens safe.
Okay, from Fox 23, Dr. Dart, are the Tulsa County hospitalizations also showing a flattening over the last 10 days, as Governor Stitt said, we are statewide?
You know, I mean, there's a little bit lag in this data, so we're not seeing that flattening here yet. We hope that the more that people continue to social distance, we'll start to see those numbers. It's too early to say that here in Tulsa just yet, though.
Okay, from Channel 6, Dr. Dart, can you clarify the 176,000 projection? And is that for the state? No,
that's cumulative for Tulsa County, from thinking that this is probably in our community in February early on that we weren't testing. So we're looking at that cumulative total from now through August of everybody in Tulsa County.
Okay, Tulsa World for Mayor Byam. Given limited in the state testing, how are policies decisions informed for the COVID-19 response? Oh, he's muted.
Try to answer it as best I can. I guess this is the challenge of doing this remotely. We have not had enough testing, adequate testing. We do not have enough testing, and I don't think any city in America has enough testing. That's the challenge of, and that's not the fault of somebody, which seems to be the game that gets played. It's a matter of this being a new virus and developing enough testing kits and the reagent that's necessary for those kits to be effective on a scale for a new virus that no one in our entire country was immune to when it hit the United States. And so the challenge that we've had here in Tulsa to date in making decisions, and that we certainly faced in the early stages, was that we didn't know how widespread it was, and we still don't. But what we can do, I think, and where I think are in a better position than a lot of cities in the country, is that being in the center of the country, contrary to the name of it, not having an international airport, we weren't hit by this as quickly as the coastal cities in the United States were. And so we were able to look at what those cities dealt with, how they handled it, how they reacted, and we got a couple weeks advance in the life cycle of this virus compared to what coastal cities in the United States had available to them. And that allowed us, I believe, to respond and put in place social distancing practices here and in Oklahoma City and that metro area as well, much earlier in the progression of this virus than you saw in coastal cities in the United States. And that's simply because we had the ability to see what they were going through. That's not something that they got to benefit from. So we owe I think, a great debt to the sacrifices made by people in cities in the coastal United States, because we were able to learn from what they were doing and respond accordingly and put in social distancing practices earlier on in the life cycle of this virus in our community than they had the ability to do. I think that's why you don't see, at least so far, as widespread an impact in Tulsa as you might in some of those coastal cities in the country. And again, all of that is fine to date, but if we don't continue doing what we've been doing, especially going into maybe the most critical part of this entire life cycle of this virus in our community, then everything we've done to date will be for naught. And so maintaining, as Dr. Dart said, that vigilance over the next several weeks is so important.
Okay, from Fox 23.
And my hope, by the way, on the testing side of things, is that we will continue to see increased testing capacity. My hope, there's tremendous incentive on the private sector side to establish broader testing so that anybody can go to a drugstore and get it. And my hope is that we'll be in a place here sooner rather than later where that's possible. I don't think, everyone in our community can have the level of confidence that they need until we get to that place.
Okay, from Fox 23 for the mayor. How strict are police going to be this week on churches for Easter Sunday? We've seen many churches doing parking lot services and more people are showing up to them. Some of them are even getting out of their cars and praying in groups now.
Well, that's a terrible idea. I don't see how putting your fellow congregants at the risk of getting a virus is a great way of showing love and faith. So I would not recommend that to anybody, nor, by the way, have I talked to any pastor that recommends that. We've had a lot of conversations with pastors over the last several weeks, and I want to say I cannot think of any of them who haven't followed the advice that we've given them. All of them have been really great to work with. They want to protect the people in their religious institutions. So I'm grateful for that. We've said from the beginning, and we'll continue to say, that churches should, as under the governor's order, should be practicing remote services, and people should be practicing social distancing when they are putting on those remote services. If people are all sitting in cars in a parking lot watching a service broadcast over a radio station, as we've had a couple churches do, I think that's a fairly low risk event, so long as people are smart enough to stay in their cars and not get out. If they get out, then it's ruined it for everyone that came to that service. But as I've said from the beginning, we're very clear on what people ought to do. The state has been very clear on what people ought to do, but we're not, the Tulsa, this is a case where we're clear on what people ought to do. The Tulsa Police Department is not going to be out arresting pastors for conducting a service where people are all staying in their cars in a parking lot. There are enough high risk issues that continue to go on in our community, which the Tulsa Police Department has been dealing with, that we're going to keep our focus on those.
Okay, from Channel 8. Mayor, we've heard talk from small businesses that they will be eventually reopening to a mountain of debt. For some, it may be easier to just declare bankruptcy and start over, but that could really hurt the Tulsa community. Can you talk about what's being done to specifically help them and how realistic it is that businesses may be open by May 1st?
Well, a couple thoughts on that. First, we've put in place this zero interest loan program for people to be able to utilize to tide yourselves over, your businesses over, until the federal funding comes to Tulsa. And this is a massive funding program that has been established solely to help businesses get through this period of time and emerge on the other side of this and be able to recover over time and get back to business as usual. But we recognize there's a bit of a lag time between today and when that funding, when the actual dollars get through the pipeline here to Tulsa. And that's why we've put that program in place. But I'm also very grateful for our congressional delegation's leadership in putting that federal program in place that will assist people. Now, I think the larger question is, when can we get back to business as usual? And the honest answer on that is that we can get back, we can start flipping the switch to go back to where we were before we started putting all these restrictions in place. I imagine it will be in a phased process. It won't all be at once. But it will be with the health department. The guidance the health department's given us on this is that it's measuring the load you expect on our healthcare system for people who have contracted this virus. And once we get to a point where we believe that moving forward, we've passed that peak and that healthcare system can handle moving forward the number of people that get the virus and need hospitalization, then we can start to phase back to normal life as we used to know it. But that is not something that somebody can just tell you, oh, in 3 weeks, that'll be it. That's something that we're visiting day to day with the Tulsa Health Department on. That's why I also think it's incredibly important that people pay attention to these two peaks that we're talking about. There's the infection peak, but then there is the hospitalization daily peak, which we expect in early May. And so I think that latter point is the most important for us as far as monitoring the health of our hospital system and being able to make sure that everybody who needs to get hospital care can get it. The last thing I would say on this is that it's very important for people to understand that, we don't expect coronavirus to just go away in mid-May. No one in Tulsa, except those who've already had it, are immune to it. It will be here for a long time. The challenge for us is not, thinking that come mid-May or June, that just everybody is free and nobody will ever get it again. It's having a pipeline in our healthcare system that can manage the flow of people who need hospitalization after contracting this virus. And what we know is, again, when you have an entire community that's not immune to it, we've said this from the beginning when we talk about flattening the curve, what you're wanting to do is spread that flow through your hospital system over a longer period of time instead of getting a giant spike all at once early on because a bunch of people contracted all at once and suddenly your hospital system can't handle it. So we're trying to spread that out over a longer period of time. And I want to set expectations appropriately there. When it comes to what we can expect over in the months ahead. But for right now, our orders, same as the federal government, same as the states, are in place through April 30th. And we'll get through this month and visit with the health department on where they think we are in the life cycle of that virus in our community. And then we'll revisit at that point how far we think we need to continue these various social distancing practices. And remember, we implemented these in phases. I would expect us to start to dial them down in phases, but all of that will be done in concert with the Tulsa Health Department, recognizing what needs to be done to keep people safe and alive.
Okay, Channel 6 for Dr. Dart. Do you recommend COVID antibody testing? If so, why? And are there antibody tests available here?
You know, eventually we really want to see if we can expand antibody testing. And really, it gives us an idea of the penetration of COVID-19 in our community. It also helps inform us on our vaccine strategy when that is ready to begin, when the vaccine's available in 12, 18 months, as the feds keep telling us. And we're actually trying to get now assess who might be doing antibody testing in Tulsa and Tulsa County, so that we can make that information available to people who want to get a test. We are at Health are not doing it yet. Eventually, I'd like to see us doing both, but we're not at that juncture.
Okay, Fox 23 to Commissioner Keith. Does the county plan to open its popular Chandler Park splash pad on time for Memorial Day weekend?
Just like everybody said, we're going to reassess as everything goes along. So I don't know the answer to that, but we are just going to have to look at all the numbers and see where we are. We won't open it if it's not safe to open it. We want to make sure the citizens and our children especially are safe from this virus. So we'll be reevaluating.
Okay, Channel 8 for Dr. Dart. Tulsa's hospitals draw in people from all over the region. Do we have we have an idea on how many people are having to be transported here for care? And are we prepared for more people from rural counties coming to Tulsa?
So that is data that is kept by our regional medical response system. They monitor that. They monitor who's being transported and transferred. So we have that information, and that information is fed into the models used for hospitals and their surge capacity modeling. So we think at this juncture that is not going to be a concern. Of course, we don't know how if the virus is going to pay attention to our models and do what we're predicting it to do. So that's why we continue to do this work and do the modeling, so that we've got the right answers for these kind of questions and for our healthcare system and healthcare providers.
From Fox 23 for the mayor, there have been pictures posted across the country of cities having issues with their plumbing and sewer lines being clogged by people throwing away things like disinfecting wipes and other cleaning products that shouldn't be flushed. Has Tulsa seen this problem yet? Is this an expensive problem to fix?
Well, it is an expensive problem to fix. I will say, though, that this is an area where, again, Tulsans are handling this, I think, in an exemplary way. Actually visited with the director of our water and sewer department yesterday, and he was super excited because we've gone 4 days without a water line break. It's another reminder that we have our crews at the city of Tulsa that are continuing to work through this, and especially in our water and sewer department, that are out there doing just incredible work. And we've not seen an unusual surge in people flushing things down the toilet or otherwise, but we certainly encourage you to keep in mind that you shouldn't be doing that. And as I mentioned earlier, we have an outstanding residential waste and recycling program here that's right there outside your home for your use to throw all that stuff away, and you don't need to try and flush it and end up clogging up your pipes or the cities. But so far, we haven't had anything unusual, thankfully.
Okay, our last question is for Commissioner Keith. Fox 23 was wanting to know if there has been people that have been applying for marriage license and currently.
Yes, they've had quite a few people even come in from out of county. We had one couple come in yesterday, and she had been out of the country and she needed one more day. So they actually went outside of the courthouse to help them do their paperwork and get it done for them. But they'll have some, I think about 30 a day or something like that. There've been, or 30 this week, but they are coming in. But there's, they do ask you to call in ahead of time on those. There's a lot of paperwork to be filled out. So don't just show up thinking you're going to be able to do all of that. Call up in advance, follow all the instructions that they have for you, and then they will help you. They've done a remarkable job of, keeping things working. And that's true of all the different divisions at Tulsa County. People are still doing their jobs. Most of the folks who are over 60 are not coming in. A lot of them are working remotely. But most of the county functions are still absolutely ongoing.
Okay, thank you guys so much. This will
Thank
conclude
you.
our press conference.
Have a good weekend.
Thank you.